Foster care, parental guidance, happier, healthier, independent foster children. First, let's talk about what foster care is. Foster care is a program that removes children from homes as a result of maltreatment and a lack of care and supervision. Under the direction of the state, foster care provides safe placement of children within licensed family homes or licensed child care institutions. Foster care age ranges from 0 years old up to 18 years old. In this presentation, I'll focus on ages 3 to 5 and Erikson's stage of psychosocial development, initiative versus guilt. The community need for foster care children is to help prepare and help the rising generation to become a benefit and enrichment to society when they become an adult. We can do this by giving them the help and care they may need. An ethical concern is that the child is receiving the personalized help, attention, and care to meet the specific needs of the child so that they can heal and overcome their difficult past. Many foster care children suffer from emotional, behavioral, neurobiological, and prenatal development issues and have special needs as a result. Some of the common struggles with foster care children are as follows: withdrawn, depression, aggression, anger, destructive outbursts, no care for consequences, lack of impulse control, social difficulty, unable to connect, emotional turmoil or sensitivity, self-harm, and frustration. With so many needs comes the necessity for specialized care and attention for the foster child so that they can overcome and heal from their struggles. A wonderful way to help a child heal and overcome their struggles is through the power of intervention. Interventions come in many different forms and have been proven to be very helpful with parental guidance and foster child's response and recovery. The intervention I've chosen, or the program I've chosen, is with video and call intervention with foster care parents. With this intervention, the end goal is to help guide and aid the foster parent through calls and helpful videos and help them to better parent and interact with their foster child in a more positive way. The goals of the intervention are as follows: lower parental stress to help lower the foster child's stress, increase positive touch with the foster child to lower cortisol levels and increase oxytocin levels in both the foster parent and child, which will also increase bonding between the two. Increase parental sensitivity response towards the foster child's behavioral signals, setting rules and boundaries in a caring and sensitive manner. Increase parental success with positive discipline. The results of the intervention were that foster parents became less stressed, increased positive touch, increased their sensitivity response towards the foster child's behavior and needs, and increased positive disciplining with the foster child. As wonderful as the intervention already is, there are 3 modifications I would add. Access to webinars. If foster parents need access to video presentations regarding specific needs, on-demand webinars could be very helpful. With today's fast-paced world, on-demand is a must, especially with Facebook, YouTube, and Twitter, among other social media outlets. With the many stresses of life, having easy access with on-demand webinars could help many foster parents find the initiative and motivation to receive the help they need for their children, even if just for a good start. An example of this would be if a child is struggling with self-harm or aggression. The parent could look up a webinar that could teach the parent how to handle and positively approach the specific issue with the foster child. Being able to target and approach one of the common behavior issues exhibited in foster children could relieve much stress and give the parent a good starting point or direction of how to help their foster child. Access to video chat with a specialist. Instead of just having access to videos or phone calls, as mentioned in the original intervention, I think being able to schedule a time to meet with a psychologist over the web would be beneficial for all involved. Foster parents and foster children are already under a great deal of stress, and to be able to To conveniently meet with a psychologist in a safe and familiar place, such as home, could help reduce the stress, tension, and unfamiliarity of a psychologist's office. Of course, this wouldn't completely replace a foster parent or child meeting with a psychologist in person if the need is significant enough. Some things are best dealt with privately in a psychologist's office. Being able to meet with a psychologist over the web could add to the stability and calm of both the foster parent and foster child, individually or together, especially in behavioral or emotional emergencies. An example of this could be if a child is acting out in anger and the foster parent needs direct, specialized guidance of how to help and approach the child in the present moment. To be able to receive the immediate help and not have to wait could be very beneficial towards both the foster parent and child. Games and hobbies. As with all children, foster care or not, research has proven that redirecting negative energy into positive energy is always helpful, especially in the learning process. This can be fun, interactive learning games, video games, playdate games, among other fun, healthy, and positive children interactions and activities. With Erikson's stage of initiative versus guilt, this could be very helpful in aiding a foster child towards the initiative of finding enjoyment and stability within positive interactions and activities. Children are precious, fostered or not, and should be protected and cared for with active determination. With a world full of easy access to endless self-help and parental guidance materials and interventions, any parent, foster or not, could be a child's protector and healer. Children are resilient and can overcome just about anything with encouragement and parental faith. Children are worth effort, attention, care, and love. They are our future and the foundation of our communities, societies, and country.